Hello and welcome to today's HIPAA Chat. I'm Carol Flagg of Answers Media Network. Thanks for joining us today. If you're new to HIPAA Chat, our format is 30 minutes or so of conversation around trending topics impacting HIPAA, followed by questions from you, the audience. HIPAA Chat is sponsored by eFax Corporate, a leader in secure faxing since 1999. Learn more about their suite of products to help ensure your ePHI faxes are protected by visiting enterprise.efax.com. Answers Media Network, of course, publishes a series of topic-driven websites dedicated to covering current issues and federal initiatives driving change in healthcare delivery. Please visit any one of our 5 sites to learn more. And of course, we host and produce original programming for Healthcare Now Radio, a streaming 24/7 internet radio station that averages over 1,000 U.S. listeners a day, 1,400 worldwide. Learn more about the station and programming at www.healthcarenowradio.com. Our host of HIPAA Chat, of course, is David Harlow. David is a healthcare lawyer and consultant and award-winning blogger with over 25 years of public and private sector experience. David also hosts a radio show, Harlow on Healthcare, airing on our Healthcare Now radio station. You can contact him at david@harlowgroup.net, and please read his terrific blog at www.healthblog, that's BLAWG.com. And be sure to follow him on Twitter at healthblog and at Harlow on HC. Joining David and me today for our conversation is Lee Barrett, the Executive Director of the Electronic Healthcare Network Accreditation Commission, or ENAC. ENAC is an independent, federally recognized standards development organization and nonprofit accrediting body designed to improve transactional quality, operational efficiency, and data security in healthcare. Lee is no stranger to Answers Media Network as we interview him annually at HIMSS. He speaks nationally in a variety of e-health and industry topics and is actively involved in key e-health industry initiatives that lay the foundation for health IT, including the HITECH Act and HIPAA. You can contact him at lbarrett@enac.org and follow his organization on Twitter at ENAC. You can find past HIPAA Chat events on our YouTube channel and on our Healthcare Now Radio SoundCloud channel. You can also engage with us on LinkedIn in our HIPAA Chat group. And now we're on to today's topics for conversation and the following Q&A. David, there's a lot to talk about today, isn't there?
Yes, it's always interesting to talk about HIPAA, at least for me, but today it might be interesting to some other people too.
Yeah. So lots of news since our last HIPAA Chat, and I guess we should start with our first item that we're talking about. And we've got 3 others, and then you actually have another bit of information you're going to pass along.
Sure. So starting off with information about a proposed change in the HIPAA regulations that will be coming down the pike. We don't have an actual draft regulation out, but the idea is that under the HITECH Act, the notion is that fines that are collected for HIPAA violations are to be shared with victims of data breaches. Now, the idea was put in play in the HITECH Act, and the notion is that that was supposed to happen a couple years down the road, and we're certainly more than a couple years down the road now, and this may come out as a draft regulation in the fall. Part of the administration's efforts to increase enforcement and attention in this arena. Now, there have been fines, of course, imposed over time, more often in the context of settlements rather than an imposition of a fine that's then contested in some way. But nevertheless, these monetary penalties are collected and they go back into the kitty and help fund the enforcement efforts. What will change in the future under this rule is that a portion of each sanction amount would be shared out to victims of a breach. Of course, that reduces the amount that would then be available to the government. So I think it's a fair question whether this means that total fine amounts are likely to increase. My sense is that they are in fact likely to increase as a result of moving in this direction. The question then comes up, how will people actually benefit who are victims of a breach? I think we've all been gotten those little postcards about class action lawsuits, and you may be you may be
Yeah.
entitled to a portion of the settlement, and then 6 months later you might get $7 or something. So is this going to be meaningful to anybody? Is this really worthwhile? Is this something that's going to be useful either in terms of satisfying individuals or in terms of increasing the pressure on the regulated community to comply with the rules as written?
David, it's Lee. I think that one of the things is, as you're bringing up this particular issue, and I think it's pretty big. I do agree with you that I think that they're going to be we're going to see higher fines. I believe for sure. I do think, however, that one of the big areas that OCR is going to need to address is to determine what's going to be the appropriate compensation that they're going to be able to, that they're going to either that they're going to give to patients that are affected by a particular breach. I mean, how do they define basically harm to an individual, and the amount of that harm, how an individual is affected, and therefore what is an appropriate level of compensation to that individual. I think that's going to be a real interesting one to see whether or not they can make that determination. And then one of the other things that I've seen is that although one option may be to share equally in overall proceeds, the concern that has been voiced there is the fact that you're not adequately compensating the individuals that may have suffered the most out of a particular breach. So then you get that particular issue. So there's some real issues here. I think that OCR is going to have to grapple with on the compensation side of the equation. That's kind of what I'm seeing out of this is kind of the big issue. But I am definitely in agreement with you on. I think that we're going to see some increase in the fines as part of how this is going to roll out.
Yeah, and I think from the patient community, from the advocacy community, this is half a loaf at best. I mean, there's no private right of action under HIPAA, as we know. So a lot of folks would rather see a private right of action. Say, well, a patient should be able to sue an individual provider or other covered entity in the event of a breach in order to recover those personalized damages that you described, Lee. There are other ways of doing this, at least in some states, but this is sort of a long and slow road. If there's a violation of state law, or if there is a finding of a violation of HIPAA, then at least in some states that can serve as the basis for a private right of action. And then an individual could proceed to pursue damages against a covered entity that had caused a breach. But that's something that is operating in parallel, obviously, with this notion about sharing amounts collected as fines.
Absolutely, and I think the other thing too, David, as we're talking about this, I think the other issue is that it's really not clear, even from everything I'm seeing, is the impact to covered entity organizations and business associates as a result of what this may mean to those organizations. So I think that's another issue that has yet to be determined. And I think the other aspect, we were talking about, I was mentioning, the no definition or guidance regarding harm. I think that whole issue as well, it's going to be interesting to see how that evolves and whether or not they're going to be able to provide additional guidance on what that means. And I think the other thing is, although this is coming out, as you indicated, David, I think end of the year, like November timeframe, I guess we'll have to see what kinds of the comments that go back, and then when this is actually going to roll out as a potential final rule, probably sometime in 2019. So going to be interesting to see how this absolutely affects a lot of organizations, and I think individuals, and how they're going to define, how they're going to, as part of this, how they're going to levy and distribute basically any of the fines that they do levy. So
right,
it's an interesting perspective for sure on how
I think it'll also be interesting to see if this rule is finalized, whether this leads to greater enforcement by state attorneys general, because the state attorneys general have the right to seek to enforce HIPAA on the same footing as OCR. There had been a flurry of activity on that front earlier on, but I'm not aware of very much recent activity by states attorneys general. If this sharing of sanction money provision is finalized, I would imagine that state AGs would be lobbied by local affected individuals or groups of individuals to pursue action where folks may think that the state AG can act more quickly or with greater effect than the federal agency.
And I think, as we know, David, we're starting to see some states, although states have got their own specific privacy laws, most of them. We're seeing a lot more states like Colorado, Florida, and even North Carolina, who I guess are now, North Carolina's, I guess, considering some additional legislation around privacy. I mean, they're as far as breach notifications, et cetera, many states, I think, are taking a far harder stance on some of the notifications and some of the provisions that they're putting in on privacy and security at the state level. So, yeah, I think it's going to be a very interesting to see how OCR continues to try to evolve their regs, how the states are going to be looking to react to that and or take a greater stance and more stricter regulations that they're going to put in at that level, and then how the attorneys general, the AGs, are going to play into this. I think, but we're definitely, I think, David, we're seeing states taking some of this a lot more, taking a far more stringent approach and position than even OCR at the federal level. So it's going to be interesting to see how it continues to evolve, David.
Yeah, that's right. We'll be talking about the new Colorado statute in a couple of minutes. But first, let's turn to a recent breach that was reported. This is the Nuance breach, 45,000 patient records discovered in December of 17 and reported in May. This is a significant breach, and it was accomplished apparently by a former employee. With the delay in reporting, it's important to note that there was a law enforcement request that the reporting be delayed so that law enforcement could complete its activities before the word got out. That is one of the circumstances under which a breach notification can be delayed.
I think that one was very interesting, because it's a speech recognition software vendor, and I think this one points up the major risk of really individuals inside organizations having access to data, and how individuals who are inside basically pose even a greater risk than many organizations focus a lot of their efforts on the external side of it, on penetration and intrusion. But in many cases, it's really the internal risk of employees, disgruntled employees or others that will take advantage, and that's exactly, I think, what happened here. I do think that the whole aspect on the notification, or their delay in notification, was certainly of interest for sure, and of note. And I think this also followed, what's interesting is this also followed the fact that earlier in 2017 in June, they had another, basically it was the not Petya infection that cost the organization about $92 million. So they had
That's right, a massive ransomware problem. Yep. And so maybe folks at the company were able to address that issue. And as you suggest, it was at a significant cost, which I believe they had to refund fees paid by clients, things like that. But the addressing of that issue did not result in a comprehensive addressing of all vulnerabilities, since we have this disgruntled former employee breach not long after, as you noticed.
Right. So, I mean, you would think that, having gone through that, they would have put a lot more emphasis on their overall controls. But, the fact that this was actually, this breach by the Nuance employee had occurred against their servers, and they accessed the personal information of thousands of individuals from several thousand, basically, contracted clients. I mean, it was pretty significant. So, I mean, I think the one thing certainly for those listening is that it certainly brings to light, I think, the fact that organizations who spend a lot of time, money, resource on external impacts or intrusions into their systems need to as well spend significant time on looking at and assuring that the appropriate controls are in place, especially around employees when they're terminated, making sure that all access to all different systems is immediately terminated. And one of the things, I mean, in many cases, a lot of people don't have as well the whole aspect of role-based access, determining really what employees need access to what data, and continuing to monitor that, continuing to make the appropriate changes, rather than continuing to give people access when in fact they don't need access to certain data. So those are the types
that often happens at smaller companies, but certainly at a company the size of Nuance, you'd expect there to be role-based access rules in place.
Yep, you would. Mm-hmm. But I think that this is just I think another kind of wake-up call to organizations and people to make sure that the appropriate controls internally are in place, and that you're constantly looking at who has access to what data, and assuring the appropriate termination procedures are in place so that people do not have access to data when they terminate from an organization. Those are the types of things in many companies, unfortunately, that the level of scrutiny is not put into it, and that this is just one example, I think, of kind of highlighting the risk of internal employees.
Right, and this also falls into the category of penny wise and pound foolish. There is a certain level of institutional commitment to data security that has to be observed, and that costs money, and people need to be willing to spend money. And if you don't spend that money, if you don't spend those resources to ensure proper data security, things like this happen, and it's a lot worse in the long run. Penny wise and pound foolish again.
Totally agree.
Okay. Glad we solved that one.
We did, David.
On to Colorado. New statute effective September 1st that is widely reported as a hard and fast rule requiring reporting of breaches within 30 days, which is, as we note on the slide here, half the time required by HIPAA. It is, in fact, a stringent rule, but I want to jump in right here and note that there are some exceptions, and I think these are sort of missed in the broad stroke reporting that has been happening around this rule. Now, in particular, I think the first exception to note, well, before we get to the exceptions, I want to say a lot of the reporting says, well, you know, we wanted to have this 30-day rule and make it simple, make it strict, not make it wishy-washy, not make anything subject to interpretation, 30 days and that's it. But in fact, it's not that strict. There is that wishy-washiness that continues to exist. It's not notice within a reasonable time, which is what some state statutes say and what the folks in Colorado objected to. But if you dig down into, forgive me, but it's section 6-1-716, subsection 2, paragraph A.2, when we talk about the 30-day reporting period, it's 30 days consistent with the legitimate needs of law enforcement and consistent with any resources, any measures necessary to determine the scope of the breach and to restore the reasonable integrity of the computerized data system in question. So we have a bunch of wishy-washy words in this strict rule. We're talking about legitimate needs of law enforcement. We're talking about measures necessary to determine the scope of the breach and talking about restoring reasonable integrity of the compromised system. So, yes, it's a 30-day strict rule, but there's still a lot of weasel words in there.
So, David, I think, you kind of reviewed it, and I think it's it's an interesting law for sure, and it kind of points to what I was mentioning earlier about states kind of taking a stricter position on privacy and security. And I think one of the things that this does too, I think this particular, from what I was reading, this really goes past HIPAA requirements for covered information, and also includes, passwords, passcodes, and similar data as well. So, providers basically need to review the law before, as you indicated, it goes into effect on September 1st. And I think,
yes,
as you were talking about, Colorado,
to medical information particularly, and there's another section that relates to other information and other personal information, and includes a provision that says that if you're in compliance with another more specific applicable law, then you're in compliance with that part of the law. But the part we were talking about that relates to medical data does not have that carve out as some other state laws do. They say, well, this is our law, but if you're subject to HIPAA and you comply with HIPAA, then you're fine. This doesn't say that.
Yep. I think this basically kind of as well, for Colorado, I mean, Florida has got, again, some breach notification timelines as well. They've got a 30-day notification, but they provide an additional 15 days if there's good cause for delay. And I guess North Carolina is considering even a tougher law, which basically they're looking to only give 15 days to report a breach. So I think it definitely points up. I think what Colorado's doing, what some of the states are doing here, is definitely points up the fact that the states are definitely taking, I think, even a harder stance than OCR is on breach notification and other aspects of privacy and security, as we're talking about here.
And if GDPR ever comes to our shores, what is it, a 72-hour breach notification requirement?
Yep, you're right. And I'm hearing some states are already looking at some of the aspects of GDPR as well. So the answer is it could get even more stringent, David, than what we're seeing with states today. If GDPR and some of the aspects of GDPR start to be adopted at state level.
Right. We could certainly see that sort of GDPR or a mini GDPR approach at the state level or perhaps at the federal level in the next Congress. Interesting to consider.
Yeah, especially since GDPR, became law back on May 25th. So, I mean, we're going to start to see, I think, implications and use cases that are going to come out of that. So I think there's going to be, we're going to see some of that certainly filter into the U.S. and into different laws that we've got for sure.
Right. Okay. On to the wonderful world of Apple. Apple has made some news in recent months by rolling out a set of tools that allows for health data transfer from electronic health records of certain healthcare systems into the iPhone ecosystem, and once within that ecosystem through APIs to healthcare applications. So as a patient, if my hospital system is participating, I could download my EHR data to my iPhone. And then if I'm using a medication reminder app or a health tracker app or activity tracker app or a diabetes management app, for example, I can then share the data from my electronic health record into those other apps. In terms of security, as usual, Apple says that it does not have access to the data. It resides on the device, and it's encrypted at rest, and it's encrypted in transit. And the only way that it could end up elsewhere is if it gets backed up to iCloud, Apple's online cloud-based storage system. But there's a separate opt-out option for the health data that would be in these apps. So it would be only on the device if that's what the individual wants to have. I think the sort of the walled garden notion starts to break down when we think more clearly about how the APIs may be used to share data out to other applications. There are at least two categories of other applications here. One could be, as I said, a personal tracking kind of application, whether it's tracking activity or other things that could be cross-referenced with things that are in the EHR data, or whether it's a type of application that could be a personal tracker kind of application, but let's say it's given to you by your doctor. It's prescribed, so to speak, by your doctor, and the information that you input into that application is then available to your doctor. Or let's say it's part of an employee health benefit plan wellness program, and then the data is available back to the plan because it's part of some wellness challenge at a large employer organization. So information that may initially not be subject to HIPAA then becomes subject to HIPAA because it falls into a category where it is being collected or accessed or touched in some other way by a covered entity. And then we do have these HIPAA concerns. Even if it's not a HIPAA concern, of course, we do have a general security and privacy concern. Apple has said they've addressed that. And the question remains, what about the other application providers in the ecosystem? That's been a bone of contention over time in a variety of different contexts, and it's certainly likely to continue to be even in this particular context. Lee, I don't know if you have other thoughts about what Apple is doing and where you see the need for some additional activity or scrutiny.
Well, I think, yeah, David, you did, it was a great overview of what they announced. It is interesting that, as I read about it, that when Apple did announce this, I guess, that they really did not talk much at all or mention HIPAA during their announcement, which was interesting.
That's not their bag.
No, it's not their bag. So I thought, that was interesting. I do think that what this is doing, first of all, I think it's very interesting application for sure. And I think as we're seeing a lot more organizations and a lot more APIs being developed to allow patients to have greater access to information, whether it's at the EHR level, portals, other types of access points. I think the whole issue of HIPAA and access and data and securing of data and who has responsibility for data transfer, whether or not it's on your smartphone, whether or not it's on a server, whether or not it's a cloud environment, a lot of this is starting to blur the lines. So I do think that I think we're going to start to see, I think, a lot more entities focusing on where there may be HIPAA implications. And I think that individuals, patients, as well as organizations, whether it's the health plans or other organizations that are developing these APIs for different use and different stakeholder use, are going to need to look at those implications and be very clear on where there are any HIPAA implications and where there are not. And I think organizations are going to need to go through that. They're going to need to as well communicate it very well. I think to those stakeholders that are going to be using the specific API, and not just assuming that people are going to have to figure it out. Because I think that's, as Apple here may have looked at various aspects of this, the fact that they're indicating they're not transferring or exchanging any or storing any of this data on their servers. As you indicated, David, that changes if I use my smartphone now to back up to iCloud, and now I've got my data on iCloud. Well, now there's some implications. So I do think that there's a lot of issues here. We're starting to see a lot more APIs developed, especially with the use of FHIR and the promulgation of the industry to use FHIR APIs. And we start to look at this in relation to 21st Century Cures, the TEFCA, the Trust Exchange Framework for Common Agreement. All of the end, FHIR is very much promulgated in relation to use with EHRs, et cetera. I just think that we're seeing a lot of blurred lines, and I think that people just need to be very careful, and organizations that are developing the APIs need to be very clear about where there are going to be implications. And so that becomes, I think, a very important aspect. And as you talked about, David, there's a lot of blurring, there's a lot of ambiguity with a lot of this right now, which I think people need to be aware of.
Right, and I think it's also important to note that, I mean, I think that there's a lot of appeal to using the Apple way for a lot of healthcare providers, but people need to remember that Apple has does not exactly control the entire smartphone space. So working with Apple doesn't mean you're being accessible to all of your patients. It means you're being accessible to some of your patients. And the other issue, as I said, is that depending on the source of the data and the source of the application that is taking the data from the patient or from the Apple API, you may need to go through a different sort of analysis. But again, the best approach is to assume that all of this is subject to the highest level of control and scrutiny and security, so that nothing falls through the cracks.
Right. I do think one thing I do like about the Apple app, I do like the fact that it is encrypted, and so that is obviously a very good control as far as that particular aspect is concerned. But it's just as you're looking at the kind of the PHI flow here, that's where it starts to get very blurred. And where organizations are going to need to understand the implications of that flow.
Right.
And before we jump into the Q&A and take some questions, David, you had another bit of news you wanted to just briefly touch upon for a minute or so before we start taking some questions.
Yes, thanks, Carol. So another recent development that I think is worth noting for this group is not exactly a HIPAA news item, but it relates to requirements around patients getting access to their data from healthcare providers. Under the meaningful use rules, which either already have been or are soon to be renamed something else, there's a requirement that the user of a certified electronic health record provide copies of records to patients within a certain period of time. And there's been many complaints over time from patients that those requirements have not necessarily been followed 100% of the time or in a timely fashion, et cetera, et cetera. There's one proposal on the table that would, if followed through, would make the timely delivery of records to patients upon request a condition of participation in Medicare. And that sort of ups the ante in terms of enforcement. That means that a whole different, quote unquote, healthcare police force is going to be enforcing this rule. It's not just the privacy police, it's the Medicare police. And the Medicare police control the purse strings, so that a failure to comply with the requirement of delivering health records to patients in a timely fashion is going to have implications far beyond a slap on the wrist from a privacy enforcement agency, and potentially have much more far-reaching consequences in terms of fines and so forth on the Medicare front. Now, right now, this is in the request for information stage. As part of the annual update to prospective payment rules for hospitals, CMS put out a request for information on this subject, and in the future they are likely to put out a rule proposing a condition of participation touching on this for hospitals, and most likely for physicians, though that's covered in a separate rule, and that'll happen in the fall, most likely. So early stages of this, but it's a development that is coming down the pike, and frankly, makes sense from a regulatory perspective, from an enforcement perspective, and the provider community needs to be ready for this at some point.
All righty. Well, with that, we're going to jump in and take some questions from our audience. You can go ahead and pose your question to David and Lee, and we will try to get to all of the ones being asked today. First question, and I guess part of it really more of a comment. Do you think healthcare consumers are becoming numb to breaches, in part due to the rise in reported breaches in other industries and other factors?
My short reaction is yes. I mean, I think that there are a lot of things that all of us can do as individuals to make our data more secure, and pretty uniformly we choose convenience over security. That's not a 100% rule. It's not based on a scientific survey, but that's my impression based on reports over time and based on what I see out in the world, where people look at me like I have three heads based on some of the things that I say about security, and they say, no, I'm never going to do that. How can I'll never be able to use my phone again if I do what you're suggesting, etc. So I think that most of us have come to peace with the fact that there's a trade-off, just as there's a trade-off when we use free websites. We know at some level that it's not free. The free use of the website comes at a cost, and that cost is access to some of our personal data. So we've made that bargain collectively. I'm not sure if we're able to walk that back at this point.
I would, Carol, I'd agree with David. I do think that people have become complacent. They're almost accepting that breaches can occur in the industry, and I do think, and I hear it time and time again. People will say to me, well, it's not. I'm too small. It's not going to happen to me. But I constantly hear about people who've had identity theft, and when it occurs like that to you or somebody you know, and you realize how difficult it is to get your identity back in a situation like that, or they've been hacked and information has in fact been compromised, people really start to understand what the impact can be. But I just like David, when I talk to a lot of people and organizations, people do look at me like I have three heads. But when they start to understand specific impacts on how it can relate to the individual themselves, then I find that people really start to take heed and actually start to do something like changing passwords on an ongoing basis, like assuring that their data, that they're more aware of phishing type emails, and so. But I do agree that people have become very complacent with it. It's happening. It happens all the time, and people it's becoming just something that people are aware of. But the hope is that people do take it seriously and take appropriate actions to manage and control their data.
Somebody chatted in, just doing some quick math here. If you take the $4.3 million fine against MD Anderson with 35,000 individuals affected, and you assume 50% of that goes back to the victims of the breach, that works out to be $65 per person. Is that worth it?
That's going to be the issue. That is clearly the issue that we were talking about is and why I think David was in agreement that we're going to see increased fines that are going to be levied, because I think they're going to look at this, look at the number of people that are affected in relation to some of these, and because you're right, the numbers don't really work. If it's $65 going back to somebody that's been affected, their data, their information has been compromised and is now affected what they can do as far as a job or some other significant impact to them, it's not going to do anything. So that's why I do think they're going to increase the fines, for one. I do think they need to come up with a way to determine how they're going to levy, not only levying the fines, but how they're going to distribute the dollars and the impact to individuals. Some of those are going to be very significant issues that OCR has to deal with here. So whoever's doing the math, you're absolutely right. It's a big issue, and I think those are some of the significant issues like harm and the impact of harm to individuals that OCR is going to have to assess here.
You're talking about GDPR, which again was passed in Europe on May 25th, I think. Can you explain what the GDPR is and how it might affect covered entities here in the US?
Well, it's a European law. It's an EU
Yeah.
law, general data protection regulation, and it essentially says that data subjects, people have certain rights, and this applies to personally identifiable information of data subjects, and requires that business processes that involve this personal information must be built with data protection in mind, data protection by design, data protection by default, and that data can't be used or shared without the data subject's explicit consent. There's a bunch of other things as well, but that's the core of it. You need to disclose how you're collecting data, how you're using it. You need to allow people to remove data from your collection of data. Data breaches are reportable more quickly, as I said earlier. So how does this affect folks in the US? I mean, some folks would suggest that it would make sense for global companies to behave as if GDPR applies in the US, because why build things to two standards if you have one standard that's protective of people? But that has not been done. Facebook has to comply with GDPR in other parts of the world, is not complying with it in the US. IBM, Microsoft, etc. So there isn't that rush to adopt these rules here, or to adopt those behaviors here. As Lee said earlier, there are likely going to be changes at the state level in different states, and potentially in the future at the federal level, that will bring us closer to GDPR, unlikely to get all the way there. And again, it's sort of incremental change on the path to more and better privacy protection.
Talking about the last item you brought up, which is the proposed rule to impose penalties for failure to provide medical records to patients in a timely manner. What will the Medicare enforcement look like in the event that there is a patient complaint regarding the timeliness of receiving their records? Do you know?
So it's not a fine per se. There's a requirement that each Medicare provider remain in substantial compliance with the conditions of participation in Medicare. Medicare recognized a long time ago that you can't have a black or white approach to that, because if somebody's out of compliance in some teeny tiny little way, it's not black or white. They're still in substantial compliance. So there are different levels of violations. Is it, a not so bad violation? Is it a pretty bad violation? Is it a terrible violation that puts patient safety in jeopardy? That's the highest level. And does it affect a handful of patients, a bunch of patients, or all of your patients? So if you think of those two categories of degree of harm as being the X and Y axis on a grid, you can see you're going to have like a 9 or a 12 box grid, and fines and sanctions get assigned based on where things fall in that grid. And this is just one of hundreds of other issues that hospitals and other healthcare providers are assessed on by Medicare. So it goes into a big calculus. It's not a one-for-one relationship between, oh, there was a breach of this record, excuse me, there was a failure to release this record to a patient when requested, therefore the institution is being fined. If that's a consistent issue over time at this institution, then perhaps that results in a fine. If it's combined with a bunch of other patient care and other code violations, then perhaps it results in a fine.
All right, going back to the conversation around Apple and the apps. Do you have any sense of how Apple may or may not educate its users on how to protect their own PHI and what the implications of having that information on the iCloud would be? I mean, presumably I'm sure there's a form that you sign off, a privacy form, but
I don't know. Frankly, I don't even know whether the iCloud backup is enabled by default or disabled by default. One would hope that it's disabled by default.
I think it's disabled by default. At least it is on my phone.
I believe it is too. Yeah.
Yeah.
So that's a step in the right direction. And there should be some sort of warning, hopefully, if someone tries to enable that backup.
Yeah.
I think going back to the question, Carol, as far as, what's Apple going to do, I do hope that, I mean, at this juncture, they were kind of indicating, as I said, they didn't even talk about any HIPAA impact when they made their announcement. I do hope that they do take a proactive stance and put in place some people to discuss in the industry and start getting involved with some of the various committees that are looking at apps and as they are developed, and helping the industry to better understand where there are going to be HIPAA implications, where there are not, and helping consumers as well as organizations that are going to be using and employing these various apps to understand and educate as well the stakeholders on what people need to do and what kinds of risks there may be. So we can hope that Apple does take a proactive stance, starts to get engaged. But at this point, and I know they are involved along with a number of organizations like Google, Microsoft, et cetera. There's a lot going on right now with a lot of those organizations that are focusing on healthcare. So the hope is that, I guess, a lot of these organizations as well continue to work with the industry in relation to educating and working through these various workflows, scenarios, so that people are made aware of what the implications are as far as the flow of PHI and what people should be doing to make sure that their information is as secure as possible.
I work with, we get this question quite a bit actually on every HIPAA chat. I work with small medical groups all the time that never take HIPAA or security seriously. How would you recommend communicating with them without using the fear factor? I'm thinking you probably should use the fear factor, but.
Yeah, so I mean, the $4.5 million fines are not going to fall on the heads of a small practice, but the $80,000, the $150,000 fines are going to fall on the head of the small practice. They have, in fact, in the past, and I think that's the simple fact that can be used. It's like these are the rules. These are enforced. Some people have been made examples of, and you could be next.
And I do think, just adding to what David said, Carol, I mean, I talk with a lot of not only group practices, but also individual doctors, even dentists. and you really have to bring up specific examples, not something that's made up. I mean, there's a lot of examples that are out there that I use to talk to these practices about the risks. And once they understand the risks, and in many cases, you have a lot of even individual doctors who will say to me, well, gee, I'm too small. Nothing's going to actually, who's going to target me? And when you start to go through and explain that in many cases, they're not even targeted. Some hacker is sending out a phishing email to thousands of entities, individuals, etc., and they count on 50% of somebody opening that phishing email. Then they start to understand that this is not something that in fact they're targeted for because they're too small. It's the fact that they may be impacted as a result of somebody just sending out an email and one of their employees opening it. And so at that point, people start to better understand the risks, the implications to their practices. And, what you want to do is not, I agree with you, not putting a fear factor, but it's talking about what organizations can do in an effort to protect their organizations, to protect their data, to protect their patient data. What's the credibility impact if there is a breach to that practice? And so those are the types of things that I focus on in talking to practices and solo practices as well, and what the organizations can do to protect themselves. And you try to make it, very, very concrete and very actionable things that practices can do and can implement, including training, including putting in the policies, the procedures, the controls, things that they can do. And there are, as everybody knows, there are some good templates out in the industry that are being used that can certainly be leveraged. It's really trying to increase the overall education and working with practices. That's what I find really helps, and more practices are really taking it seriously and implementing different controls and different aspects within their practices to better protect patient data and their practices from a breach, an incident, or a cyber attack.
Right, and the implementation. Not everybody is an MD Anderson. Not everybody's on that scale, right. And the implementation for a small practice is going to be very different than the implementation for a large healthcare system. And I think sometimes people lose sight of that. That's important to emphasize as well.
Yeah. Well, believe it or not, we are actually just about out of time. If we didn't get to your question, please, and we didn't, to many of them, please email David at davidharlowgroup.net or Lee Barrett at lbarrett@enac.org. David and Lee, it's been a fascinating conversation. I appreciate the great HIPAA Chat today.
Thank you, Carol. Thanks, David.
Thank you all for joining us, Lee. Thank you, Carol. And thank you to everybody for listening in today.
And we'll be back for another HIPAA Chat this summer, so stay tuned for the details on that. To all of you here joining us today, thank you so much for your time.